Welcome to the fascinating world of medical diagnosis. As a medical student, you're embarking on a journey to master this crucial skill. Diagnosis is both an art and a science. It requires keen observation, critical thinking, and effective communication. Your goal is to identify the underlying cause of a patient's illness. This allows you to provide appropriate and timely treatment. The process of diagnosis is like solving a puzzle. You'll gather information from various sources. These sources include the patient's history, physical exam, and diagnostic tests. You will then analyze this data to form a diagnosis. This is a challenging but rewarding process. Mastering it is essential for your success as a physician. Remember, accurate diagnosis is the cornerstone of effective patient care. By mastering this skill, you will be well equipped to make a real difference in the lives of your patients.
Taking a patient's history is the crucial first step in the diagnostic process. It involves actively listening to the patient's story. You'll need to ask open-ended questions. This encourages the patient to share their experience in detail.
Start by asking about their chief complaint. Why are they seeking medical attention today? Next, delve into the history of their present illness. When did the symptoms start? How have they evolved? What makes them better or worse?
Remember to inquire about their past medical history. This includes any prior illnesses, surgeries, or allergies. Don't forget to ask about their family history of diseases. Finally, gather information about their social history. This includes their occupation, lifestyle habits, and living situation.
The patient's history provides invaluable clues. These clues guide you towards a diagnosis.
The physical exam is the next vital step in the diagnostic process. It involves a systematic, head-to-toe assessment of the patient's body. You'll use your senses of sight, touch, hearing, and smell to gather information. You'll look for any abnormalities that might suggest an underlying condition. Begin by observing the patient's general appearance. Do they appear unwell? Next, assess their vital signs. This includes their heart rate, blood pressure, respiratory rate, and temperature. Proceed to examine each body system. This includes the cardiovascular, respiratory, gastrointestinal, and neurological systems. Throughout the physical exam, pay attention to the patient's verbal and nonverbal cues. These can provide additional insights into their condition. The physical exam, combined with the patient's history, helps narrow down the potential diagnoses.
With information gathered from the history and physical, you can begin formulating a differential diagnosis. This is a list of possible explanations for the patient's symptoms. Start by brainstorming all possible conditions. Consider common and rare conditions. Next, prioritize the diagnoses based on the patient's specific presentation. Take into account their risk factors, symptoms, and physical exam findings. A helpful mnemonic is VINDICATE. This stands for vascular, infectious, neoplastic, degenerative, iatrogenic, intoxication, congenital, autoimmune, allergic, traumatic, and endocrine, metabolic. This mnemonic helps you consider various categories of disease. It ensures a comprehensive approach. Remember, the goal is not to jump to conclusions. It is to systematically consider all possibilities.
Section 5. Laboratory tests. Unveiling the unseen. Laboratory tests play a critical role in confirming or ruling out potential diagnoses. These tests analyze samples of blood, urine, or other bodily fluids. This helps detect abnormalities that may not be apparent on physical examination. Commonly ordered tests include a complete blood count, basic metabolic panel, and urinalysis. A complete blood count provides information about the different types of cells in the blood. A basic metabolic panel measures electrolytes, kidney function, and glucose levels. A urinalysis can detect infections, kidney problems, and other conditions. Specialized tests, such as blood cultures or biopsies, may be necessary depending on the suspected diagnosis. The results of laboratory tests, interpreted in the context of the patient's history and physical exam, provide valuable insights into the underlying disease process.
Section 6. Imaging. Illuminating the body's interior. Imaging studies allow us to visualize the inside of the body. This helps identify structural abnormalities or pathological processes. Common imaging modalities include X-rays, ultrasounds, CT scans, and MRI scans. X-rays are useful for evaluating bones and some soft tissues. Ultrasounds use sound waves to create images, particularly of organs and blood vessels. CT scans provide detailed cross-sectional images of the body. MRI scans use magnetic fields and radio waves to generate highly detailed images of organs and tissues. The choice of imaging study depends on the suspected diagnosis and the body area being evaluated.
Section 7. Putting it all together. Reaching a diagnosis. After gathering all necessary information, it's time to synthesize the data and reach a diagnosis.
Review the patient's history, physical exam findings, laboratory results, and imaging studies.
Look for patterns and connections that support or refute your initial differential diagnoses.
Consider the most likely diagnosis based on the available evidence. This is known as the working diagnosis.
If the diagnosis remains unclear, further investigation with additional tests or consultations with specialists may be necessary.
Effective communication with colleagues and experienced physicians is crucial throughout this process.
Remember to involve the patient in the decision-making process. Explain the suspected diagnosis, treatment options, and potential risks and benefits.
Section 8. Common diagnostic errors and how to avoid them. Diagnostic errors are unfortunately common in medicine. They can have significant consequences for patients. One common error is premature closure. This is the tendency to settle on a diagnosis too early in the process. Another common error is anchoring bias. This is the tendency to fixate on the initial diagnosis, even in the face of contradictory evidence. Confirmation bias occurs when we selectively seek information that confirms our preconceived notions while ignoring contradictory evidence. To avoid these errors, maintain a broad differential diagnosis. Always be open to considering alternative explanations. Critically evaluate your own thought process. Seek feedback from colleagues when necessary.
Section 9. Honing your diagnostic skills. Tips for success. Developing strong diagnostic skills takes time and effort. Start by actively listening to your patients. Ask clarifying questions and strive to understand their perspective fully. Pay close attention during physical exams. Develop a systematic approach to ensure you don't miss any crucial details. Stay updated on the latest medical knowledge and diagnostic guidelines. Attend conferences, read medical journals, and engage in continuous learning. Seek opportunities to practice your diagnostic reasoning skills. Discuss cases with colleagues, participate in clinical case presentations, and seek mentorship from experienced physicians.
Medicine is a constantly evolving field. New discoveries and technologies emerge regularly. Embrace lifelong learning as an integral part of your medical career. Attend conferences, read medical journals, and participate in continuing medical education courses. Stay informed about the latest diagnostic and treatment guidelines. Engage in research and contribute to the advancement of medical knowledge. By embracing lifelong learning, you'll ensure that your diagnostic skills remain sharp. You'll be equipped to provide the best possible care for your patients. This dedication to continuous improvement is a hallmark of a true medical professional. Section 11. Conclusion. Embracing the challenge of diagnosis. Mastering patient diagnosis is an ongoing journey. It requires dedication, critical thinking, and a commitment to lifelong learning. Embrace the challenges and rewards that come with this crucial aspect of medicine. Remember that accurate diagnosis is the foundation of effective patient care. By honing your diagnostic skills, you're making a real difference in the lives of your patients. As you progress through your medical career, always approach each patient with empathy, curiosity, and a thirst for knowledge. The ability to accurately diagnose and treat illness is a privilege. It is a responsibility that lies at the heart of the medical profession.